Thank you for joining us for Unite for Sight's webinar entitled Beyond Good Intentions, Designing Fulfilling and Impactful Careers in Global Health. We're thrilled to have all of you with us here today. My name is Amy Bellman Davis, and I am the Executive Director of Unite for Sight. I'll briefly introduce you to Unite for Sight, review the webinar logistics, and then we'll hear from our 6 panelists. Unite for Sight is a global health nonprofit organization that promotes high-quality care for all. We offer extensive global health and social entrepreneurship education programs. Our Global Health University program offers a free webinar series, including today's webinar. We also offer 20 online certificate programs for students and professionals. Many students receive academic credit for completion of our certificates, and professionals often pursue the certificates for professional development. The certificate topics range from a certificate in global health to a certificate in responsible NGO management to a certificate in cultural competency. The conference includes more than 200 speakers and more than 2,000 participants for a weekend exchange of ideas across all disciplines of global health, international development, and social entrepreneurship. The final deadline for research abstract submissions is October 15th. The conference website may be found at www.uniteforsight.org/conference. Unite for Sight also has healthcare delivery programs that provide care to patients living in extreme poverty. We partner with phenomenal local eye clinics in Ghana, Honduras, and India to provide quality eye care to patients who are otherwise unable to access or afford care. These programs are locally led and managed by the local medical professionals, and our collaboration has provided eye care to over 2.7 million people by local doctors, including more than 106,000 sight-restoring surgeries by local ophthalmologists. Unite for Sight is the world's only organization that is a healthcare delivery organization that also offers immersive global health education and social entrepreneurship opportunities for students and professionals. Participants support and learn from local doctors in Ghana, Honduras, and India as they provide care to patients living in extreme poverty in villages, slums, and refugee camps. Participants learn from the local medical professionals about patient barriers to care and about effective strategies to reach the hardest to reach patients who are otherwise unable to access or afford care. The local doctors are social entrepreneurs who design effective and innovative strategies to eliminate patient barriers to care. Now I'll describe the basic logistics of this webinar. We're so delighted to have all of you with us today. We have 6 amazing panelists, and they have a wealth of expertise to share with you during this next hour. Each of our panelists today will give a 2-minute introduction about themselves, their current role, and their key guidance or lesson learned regarding how to pursue a fulfilling career in global health. We'll then dedicate the remaining time to your questions and answers. We received stellar questions already submitted from you, our audience, by Tuesday's question submission deadline. We selected the most common and most thoughtful questions to ask our panelists. We also invite you to submit additional questions in the text box on the left of your webinar screen, and we will include some of those questions in our discussion today too. We also encourage you to tweet about the webinar, including your key lessons learned, by using the hashtag GHUWebinar, and you can see the hashtag in the webinar visuals on your screen. We'll proceed with having our panelists introduce themselves in alphabetical order. I'm delighted to introduce you to our first panelist, Scott Corlew. Please begin by introducing yourself, your background and current role, and please share your key guidance about how to pursue a fulfilling career in global health.
Well, hello, everyone, and I'm flattered to be part of this. I am part of the faculty at the Program for Global Surgery and Social Change. We're a division of the medical school here at Harvard. Our main focus is strengthening surgical systems as part of UHC. We do largely research and policy development and work with surgeons and others in low-income countries. My background, I'm a surgeon by training, a plastic surgeon by more training. I practiced for a number of years. I spent several years as CMO for Research International, one of the surgery NGOs, and I'm now here. And let's see, you said greatest advice or lesson learned. I think I would say develop your skill set. whatever that is, whether it's quantitative analysis or a basic research or clinical research or any field of clinical medicine, be it ID or pulmonology or surgical field or whatever. We all want to do good in the world, but can do so much more good if truly capable people develop their full potential. So I would say, in a word, develop your skill set.
Perfect. Thank you, Scott. Rebecca, would you like to introduce yourself next?
Sure. Hi, everybody. I'm so glad to be back on one of these webinars. I have to confess I'm a little addicted to them because I find the conversations always leave me feeling very energized and hopeful about the way that professional fields can move forward, getting smarter and more effective all the time through dialogue and through sharing. I'm a professor at the School for Environment and Sustainability at the University of Michigan, ranked the #1 public research institution in our country. And I'm really proud to bear that mantle because, you know, our motto is an uncommon education for the common man, and I would add woman. And I really believe that mission is so needed in the world today. That sort of brings me, in a way, to the key lesson I would share on the front end of this, which is to learn from those coming up behind you and around you, even as you teach many of your peers and them. I think this idea of the learners as and the teachers as learners is very important. I was Jennifer Staple, the founder of Unite for Sight's teacher, and she has taught me, Unite for Sight has taught me a great deal about how to bridge gaps, delivery gaps, and how to create communities that are communities of learners where it's less about hierarchies of knowledge and more about sharing best practices. So that's my 2 cents, and I look forward to talking more.
Thank you, Rebecca. Vanessa, would you please introduce yourself?
Sure. I am Vanessa Carey. I am the CEO of Seed Global Health, an organization that believes that health is fundamental to the ability to not just survive, but to thrive, and that the critical to being able to invest in health is having strong, robust health systems that are people-powered. And so we focus on training doctors, nurses, and midwives who are the backbone of health systems and can not only provide care, but can be able to train their successors, support the health sector writ large, and serve as agents of change. I'm also trained as a physician. I work at Mass General Hospital, where I'm on faculty there and work at their Center for Global Health, as well as work in the ICU. And then I'm now teaching both at Harvard and just started teaching a course called The Politics of Global Health at Yale in order to really begin to talk about the power of how health integrates into everything that we do. I am a big believer that you can cross any bridge through understanding, through listening, and through sort of shared problem solving. And so when I think about how we solve big problems in the world, I think it's really important to listen to even those people you see as your opponents, because you will always be able to find common ground, to find a way to work forward. And I think that's needed more than ever right now.
Thank you, Vanessa. Marie, would you please introduce yourself?
Sure. My name is Marie Martin, and I am at the Vanderbilt Institute for Global Health, where I direct education and training activities. I'm also a professor in health policy and direct our global health track for our MPH programs. I get questions about career development all the time, so I'm thrilled to be on this call and learn from others around me. So I work at this intersection of education, health, and policy, and I've really focused the last 20 years of my career on curriculum and academic program development in the U.S. and abroad. And my focus has been on global health the last 10 years, really developing broadly human capacity to improve health outcomes. If I think about my greatest advice or lesson learned in global health and career development, I actually would build off of what Scott, Rebecca, and Vanessa just mentioned, in that I think identifying your niche area of expertise is important. So, in order to build a skill set, you also have to figure out what you're really good at, what you enjoy doing, and what the world needs. I love Frederick Buechner, and one of his famous quotes is finding where our deep gladness meets the world's deep need. So really identifying that and then building up your skills around it. Networking, including identifying diverse mentors. So as Vanessa mentioned, these diverse voices, incorporating that in your decision-making process and really relying on that. Networking, building those networks, and also creating a succinct vision statement for yourself. Some people call it an elevator pitch, other people call it a career pitch, but whatever it is, be able to tell who you are very quickly and what you can do to really move forward some of these health programs. And then lastly, be okay with failure. Everyone fails. It's okay. Pick yourself up and move on, but really don't let failure stand in the way of big ideas and doing great things.
That's great advice, Marie. Thank you. Lisa, would you please introduce yourself?
Sure. Well, thank you very much for having me again. So my name is Lisa Russell, and I work primarily as a filmmaker, but I have an interesting career path in that I didn't go to film school. I actually got my master's in public health back in the late 90s from BU and set on this career path of wanting to be a humanitarian aid worker. So got my first job in Kosovo and Albania working during the refugee crisis in 1999 and had just a series of experiences where a lot of the Kosovar, particularly Kosovar women, were really upset with the journalists and their sort of practices of collecting stories, in the refugee camps. And it just sparked this interest in me of, critiquing sort of storytelling and filmmaking in the UN NGO space, and also feeling like with a health and human rights background that I could change the narrative and the dynamic of how stories are told. So I embarked on becoming a filmmaker, and since then I'm a full one-person crew. I work as a director, I produce, I write, I shoot, and I edit a lot of films for different UN NGO agencies, and I really love everything that I do. And I've been doing that for about 15 years now, and so I'm sort of transitioning a little bit more into really trying to figure out how to build institutional credibility for artists and filmmakers and storytellers in the UN NGO space or around the SDGs. And so really I would say that my work lies, I'm kind of an activist that makes films. I do a lot of social justice and global development work. And I also am the founder of Create 2030, which is about engaging artists and filmmakers in the SDGs. And I'll wrap up with, I think my greatest advice comes from years of being criticized for decisions I was making about my career, where I was told I couldn't really mesh these two worlds. I should either be fully a filmmaker or fully a global health specialist, that I couldn't do both. And I would say that now that I sit on the other end of it, and this has become like a really almost a popular career path now, or it's growing, is that don't take no for an answer. And I think that innovation and creativity really exist when you take two very different worlds and mash them together to create something new. So don't be discouraged by family or professors or anybody trying to tell you that maybe an idea of what you want to do in this space is crazy or not really doable.
Thank you, Lisa. Michael, are you great? Would you please introduce yourself? Thank you.
Sure. Good afternoon, everyone. Thank you so much for inviting me and allowing me to be on my first time on one of the Unite for Sight webinars, so very excited about that. So my name is Michael. I'm the Assistant Deputy Secretary for National Security at the U.S. Department of Health and Human Services. And so in that capacity, I function as the National Security Advisor to the Secretary. And so what we do is we look at those particular areas that we can protect, promote, and advance the public health of Americans, both domestic and abroad, and protect them from adverse actions. And one of the things that it's allowed me to have the opportunity to do is, while I did start in academia, I did move over to the federal government and start off with the U.S. Centers for Disease Control and Prevention. Fantastic experience, worked with the Centers for Global Health, and ended up working with 33 different countries overseas and living in in several of them throughout Central Asia as well as Central America. Also afforded me the opportunity to be among the first U.S. government responders to the Ebola outbreak in West Africa in 2014, and then one of the last responders when I went back, and do pretty cool things like working with the military, specifically the Navy, as they do some of their hospital ship missions, and was engaged with a BBC documentary and that type of thing. And then to round it out, a lot of the activities that we do is support the almost 100 different international offices that are overseas working in ministries of health, ministries of agriculture, ministries of emergency situations, to partner on things like the Global Health Security Agenda and Global Health Security Initiative. And so my advice, lessons learned, is don't say no easily. Because one of the things that I found is in my career over the last almost 20 years working on international health is I would do the things that sounded fun at that moment, not necessarily the things that seemed to be in some sort of career path or something along those lines. And what I found is those experiences beget other experiences. And, by not saying no to something that seemed a little out of the ordinary, had some really great opportunities to work with some fantastic folks. So thank you.
Thank you, Michael, and thank you to all of our panelists. As you heard, they all have a wealth of expertise and guidance to share with you today. We'll now proceed with the question and answer session. As mentioned, we received questions in advance from you, our audience members. If you have additional questions, please post them in the text box on the left of your webinar screen. Our first question is for Vanessa. Vanessa, what do you wish that you knew at the beginning of your career? Looking back, what would you want to tell yourself at the start of your career?
That is a great question. It's interesting. I've been reflecting a lot on this lately. And I think that it's interesting. I still struggle with it. It's what you're hearing, the hesitation in my voice. I think what I would tell myself is that even though I had an outside of the box idea and I was trying to carve a path that nobody had carved really before me, at least not in the spheres I was working. Nobody else was really in the public policy and kind of from a implementation standpoint field. A lot of people doing the research in it, but not necessarily implementing and advocating. And so in the academic world, folks have not necessarily known what to do with me. And in fact, one of my bosses refused to promote me because he said my work was not core to what we were doing. And I think it really did a lot to undermine my faith in myself and what I could accomplish and my belief in myself. And I'll tell you that that can be really tough. And to be really candid, also being a woman, it can be really tough because you get lots of challenges along the way with having kids and how you're going to balance your work life. And I'm not saying that men are excluded from that either, but I want to just acknowledge it. And I wish that I had a little bit more that, in the same way that I think it was Michael had said, that I don't accept no easily. I think sometimes I backed off faster than I wish I had on certain things. And in the end, I feel that I've been vindicated. We've done incredible work over the last 6 years. And I think that now it's been in a place where people realize that my unconventional path is actually something of value, even in the academic world. And they've worked very hard now they've worked hard to help me support this mixed arena of nonprofit advocacy, engaging with governments and policy to help change policy, and then also to be in an academic setting and to be promoted for it. But I think just so the long story short is to say that really, I think telling myself back then, trust your gut and go with it, and don't be afraid to push because it'll lead, yes, into unconventional territory, but it will be worth it, and you will be able to do the things you want to do with, and hopefully help create the kind of change you seek to create.
Thank you, Vanessa. Our next question is for Michael. Michael, what did you find most helpful in making the transition from school to work, and what are some of the most valuable lessons that you've learned more recently?
I think the most helpful transition I made from school to work. So I basically took about 2 years off in between the bachelor's and the master's, and then 2 years between the master's and the doctorate. And so the transition that I tried to do is to have practical experience in between the academic degrees to help lend itself to what I found to be usable, we would like to say tips, tricks, tactics when you're actually doing your academic program. And so I found that instead of going directly through all of the academic programs and having some time where I was actually working in the field, either domestically or internationally, that was a great way to build on those experiences to make the success of academic degrees richer. So, for example, my master's program, I was able to leverage those field experiences that I had had in between times. And so, for example, in the federal government, you have opportunities relating to epidemiology, laboratory work, and those types of things where after you finish an undergraduate degree, you can really get your hands, as Thomas Jefferson would say, into the soil, working with local county health departments or sometimes even ministries of health overseas. And so I think that transition, to answer the first part of the question, was really taking a breath and not trying to rush through and being able to build that experience base that you can work on to your programs. And then I would say the most recent lessons learned is it's kind of like what you've probably heard from your parents or grandparents, that the more you know or the more you find out, the more you realize you don't know. And that is especially true with global health. And so it's a conundrum, because the more experience you get in global health, the more you realize that there are very extreme differences, for example, in how different countries, ministries, the local level or whatever it is, addresses a particular problem, especially as it relates to health. And so you really have to take a step back. And that was a tough lesson to learn, because when I was new in the field, I was thinking, oh, yeah, of course I have international health experience. My experience in Guatemala will be translatable to my experience in Kazakhstan. It was not true. So that was a good lesson learned.
Thank you, Michael. Our next question is for Rebecca Hardin. Rebecca, how do you combine new ideas and passions into your career? How do you decide what new ideas or opportunities to pursue and which to consider for a later time or not at all?
Yeah, that's an interesting question, and thank you for it. I think it relates in part to what we've already heard on the line about when you should say no and when you shouldn't. And you shouldn't say no because you fear something doesn't fit in terms of substance. You should say no because it doesn't fit in terms of your energy, perhaps. And that question of how brave to be and how much to self-protect is a very, very tricky one. Like, how expansive to be and when do you need to self-protect and sort of withdraw into your comfort zone, and when do you feel ready to expand and try new things? And I will say I agree with my fellow panelists very strongly that both are important, that you need to be able to feel in your career like you know how to identify a moment when you're ready to expand, or an opportunity when it crops up. And you need to be able to know when you are in a mode where you need to withdraw and build your strengths, your core strengths, your core skills, right? And so I would say there's a kind of, in my experience, there's some cyclical natures to that in terms of my own, your own life stages, right? Like, are you building a family? Are you caring for a loved one or a friend who's in need? Are there things happening in your personal sphere that are going to dictate which of those two things you should do? There's that. But beyond those considerations, I would say there's a kind of, for me, there's a kind of formula, and it has to do with identifying important trends. Here's a good one. Coding and, web developing, and what that makes possible for people with the kinds of social mandates we all share here on this call. That is something that I identified as a trend, but it took me quite a bit of time to find the kinds of developers that I felt would understand and honor those mandates and what they were building with me, and not be instead pursuing a kind of template of venture capital investment and profit maximization and use maximization, but who could be more iterative, more clear, And so there's an open access learning platform that we've created for sustainability learning called Gala, which is named after a Michigan apple. It's learngala.com. It's a completely free, multimodal, translatable, multilingual tool. It's very young, but it's getting a lot of use already, and I'm really proud of it. And I would say that the combination of identifying that broad trend, but then waiting until I felt comfortable with the individuals and partners that I had to have a kind of ethical and unique approach to that trend. That's something that I would advocate is temper your sense of what's dynamic and what's hot with trust and a kind of sense of core values.
Sorry. Thank you, Rebecca. Our next question is for Lisa. Lisa, you have combined your interest in global health with your skills as a documentary filmmaker. What advice do you have for those interested in similarly developing their own novel career path?
Well, thank you for the question. So I joke sometimes that I'm multilingual because I feel like I speak the UN language and I speak the global health language, and they are very different languages and they have very different work cultures. And I think for me, I was definitely one of those students, college students or whatever, who was really having a lot of angst about what I wanted to do for my career because I was interested and had skill sets in a lot of different areas. Like I was a dancer, I painted, I did a lot of cool stuff, but I was really good at math and science. And then I wanted to do good in the world, but at the time I couldn't figure out a career that would allow me to sort of utilize all of those skill sets. And so in my wanting to go, down the academic master's in public health route, my dance and my creative stuff was pulling at me. But when I was doing all of my creative work, the sort of more, academic and intellectual side of me was pulling at me. And so I really ended up, I think, with the perfect career path for me, which was that I get to do both. I really get to, I get to keep learning, like learning new technology, learning new storytelling devices, learning all of this, the new issues that are pressing is really exciting and challenging for me. But I would say that, for those of you who might have a little bit of an angst in figuring out what you want to do, especially if it's not something that's very kind of traditional global health, career path, is that you got to be patient. One, I essentially had to conquer two careers before I found the one that blended the two, and just expose yourself to as many different things as possible. I think if I had stuck with one lane, I would not have been able to figure out how to put everything together to do what I do today. And what's beautiful about, getting older and then doing this for so long is that I look back and I was like, everything that I did was actually necessary for me to be and do what I do today, because editing requires like a lot of pacing and a lot of flow, and that comes from playing music and dance. I taught myself how to edit on Avid, which is not an easy program, and I think partly it's because I have a science background. And then, being able to, I do a lot of films for UN NGO agencies. I cover a lot of global health topics, from maternal health to, HIV, AIDS, to a lot of different parts in global health issues, but I can have that conversation because I was a pre-med student. So I think that I've spoken with many students who are a little like, well, I don't quite know what I want to do or where I want to go, and you feel like overwhelmed. Just know sometimes be patient with yourself. It can take a while, especially if you're trying to do something that's not mainstream.
Thank you, Lisa. That was very helpful. Our next question is for Marie. We're switching gears a bit. Marie, what key advice do you have for those seeking a career in global health academia? Also, how do you balance a need to publish with the desire to spend more time in the field doing clinical work, teaching, and strengthening collaboration?
I would say, first of all, there are a lot of different roles that you can play within academia. there's obviously the traditional faculty role, and a tenured one at that, which really requires you to publish or perish, as they say. But there are lots of other roles that you can play. There are faculty roles that are non-tenured, for example, that may give you greater flexibility. And then the programmatic roles, teaching roles. And so I think the first question is, what role do you see yourself playing in an institution of higher education? And then a lot depends on the institution itself. So when you're thinking about where you might land, either after your doctoral training or after other training, or if you just see yourself in a teaching institution, you may be in a public or private institution, one that focuses on research or one that focuses more on teaching. And that really, I think, either opens up more opportunities for global health engagement or maybe limits them. So to whatever degree possible, and I think someone even alluded to this, our careers change over time based on our needs or demands, family, health, career opportunities. But I would say if there's a way that you can do all at once, or even have that as a career goal, it's great. So imagining how your published work could come out of your field work, how you might leverage interested students and funding opportunities to drive scholarship on the ground, whether that be focused on implementation science or program evaluation, or really focused on those interventions on the ground that really can produce some good learning around what works and what doesn't work in the field. And, as others have said, really think about what kinds of tools you have and how you might be able to align those with the needs on the ground if where you want to be is in the field. If you want to have a hybrid life, I have a hybrid life. I live in Nashville and do a lot of work here, but then I travel a fair bit and partner with great academic institutions abroad. So there's a way to develop your careers based on how much time you need or want to spend in the field. But I think being patient and flexible and open to lots of different kinds of opportunities in the process would be critical.
Thank you, Marie. Would any of the other panelists like to speak to that question?
And actually, Amy, this is Scott. I'll chime in. And
good.
Mainly, I think I'll mainly emphasize something Marie said there, and that was, if you can do it all at once, great. But I think what often happens is people do lead hybrid lives, and that's not a bad way to go because it maintains your skills in all your different fields. And if you can do your field work and, like she said, come up with your research questions based on your field work, which frankly is pretty easy to do, that's where our research questions come from, then you can pursue them. And again, leveraging your grant money if you have it, and your trainees to assist with that is very helpful. So anyway, I think most people do end up leading hybrid lives and it works. The downside is you often get paid for the work you do at home, and you often don't get paid for your field work unless you've got some grant willing to pay it.
Thank you, Scott. That was a really helpful addition. We appreciate it. Let's see. The next question will be for Vanessa. Vanessa, how should universities and employers ensure that those engaged in global health truly understand and participate responsibly and culturally competently in the field?
I love this question. So I think it's a responsibility of anybody running a program in global health engagement to make sure that there is a culturally responsible and engaged and really monitored way of partnering. And I think it starts from just a very kind of structural pieces you put together in a program. And I think that if you are going to be participating and having people do bilateral exchanges and, going abroad, I think it's incredibly important to verse people well in what it means to be in another culture. And so at Seed, what we've done with our the folks that we send to serve abroad is, one, we require them to go for a year, because we think it's really important to build trust and relationship and to understand where you are and to go to weddings and to go to funerals. And I recognize that's not possible, especially in medical careers, to always spend a year. But I think that making sure that people have a healthy understanding that you have a privilege to go as a visitor, that you don't have the answers to everything, that your job is to partner with your colleagues on the ground, to think about how you can transform these places and have a mutually beneficial learning experience is really important. And I think it's incredibly important that when you students, especially going over, that they are really guided with an understanding that they are still students in any setting, and that it's really important that they follow those boundaries, because I know a lot of times students are either put in a position where there's just not enough staff and they're being asked to do things beyond their training, or sometimes it's an assumption, well, I come from a country like the U.S., so I must know more. And I think that's a real fallacy that needs to be broken down. So I think it's about orienting people before they go. I think it's about appropriate monitoring and support in those settings, because it can be really difficult to work in places where you're seeing a lot more death and suffering than you might hear because of a lack of resources. There needs to be solid support structures in place for everybody to deal with that and to be able to talk about it. I think it's important to have those things in place. This goes back a little bit to the previous question too, but I also think it's important for schools and academic centers to make it possible for people to do this work in a way that is investing in them as faculty and humans, because then it makes it possible for them to do all of the pieces of the work that are important to have. So to say, I understand you need to spend more time there. We will hold your job for you if you want to spend a year building relationships so your research is more effective. We recognize the importance of this work, and we will promote you for it, and we will help think about ways to, support younger students, younger trainees and people who want to be a part of this work. And I think there's a responsibility of academic institutions to set a value to investing in global health that is backed by actual action. Because then also by creating it as a building the legitimacy around the field, it also forces the field to ensure that it's following, really rigorous rules and regulations and isn't something that's being cobbled together. So there's structural things that I think need to happen that are really, really important. And I think we have to help demand that for those of us in the field. And it speaks to the fact that, I created a program that works to send U.S. faculty to embed as faculty and to train others. But then I started to write about it and publish on it and really, help create a mechanism to be, for this all to be recognized. And so I think the most important thing is to have humility, but also to ensure that we're doing this with the kind of rigor and respect that is important in any work in medicine.
Thank you, Vanessa. That was very helpful. Our next question will be for Scott. Scott, how can those seeking global health opportunities ensure that they will be employed by an organization that is relevant, culturally responsible, and effective?
When you take a position, the first thing you have to do is have an idea of what your skill set is. And how would you like to use it? Opportunity gift wraps exactly like you envisioned it. Princes do sometimes look like frogs, and it's worth peeling back and really examining potential organizations for which you might work. Then I think try to get as familiar as possible with the organizations that might interest you, and if possible, even spend some time within or around that organization and its work. Sometimes you might be able to do a short-term, even 2 to 4 week internship within an organization and see what its culture really is. One nice thing about 2019 is that research on organizations through the internet is infinitely easier than it was only a few years ago. And don't always trust the PR you might see too. If you have friends or friends of friends working within or around an organization, they can be a great source of information. And again, to let you know exactly what the culture within that organization is. So I think largely, you're never going to ensure yourself anything, but I think you can really get a reasonable idea of what organizations seem to be relevant to what you're looking for, what you think is important, seem to be doing what they say they do, seem to be responsible to the people they work for and with, and seem to actually be doing it. So I think if you spend the time and sort that out, as a general rule, you won't go wrong. And again, as someone said earlier, don't be afraid to fail, and if you do, that's okay. Everything is a learning experience.
Thank you, Scott. Lisa, the next question is for you. What is your process to ensure that you ethically and responsibly communicate about local communities? How should your lessons learned be applied by all working within the many different fields of global health, whether it's clinicians, researchers, students, etc.?
Great, really important question. So I'm going to start with specifically talking about storytelling because that's obviously what I know best. But I like to, and I'm biased, but I do believe that, artists and filmmakers and storytellers are influence public opinions. We move people. There's even research that's really interesting that was done that shows that the brainwaves, a researcher studied brainwaves of a storyteller, and they actually match up with people who are listening to the stories. So there's a physical connection between a storyteller and the people listening to the stories. And so I do strongly believe that storytellers are incredibly powerful. Plus, we've seen this, over the, centuries with griots and whatnot. But I think in the global health arena, it's very interesting because I really feel like we're probably one of the only industries that gets mocked and criticized for the kind of stories we tell. And that's because there's this sort of emphasis on emotionally exploitative storytelling, like, they call it poverty porn. And I struggled with it myself because this is why I got into filmmaking in the first place, is because of the kind of exploitative practices of these journalists in Kosovo. But I knew that it was wrong, but I didn't know what the solution is. It's one thing to say, we need to change the narrative, but what does that actually look like? Because telling stories about poor people smiling is not the answer. And so I've been on a 15-year journey trying to answer this, like, how do we actually do this the most responsible way possible? And I've looked to other industries to see how they do storytelling, and I do think, some of them, like the tech industry, for example, focuses on solutions more than problems, which I think is an interesting way to shift the narrative. And I also believe that we can start changing the narrative from one of sort of a charity-based narrative to evoke pity, to one of justice, which promotes empowerment. And so there's slight shifts that we can do to improve the ethics behind storytelling. And I do encourage people who are interested in global health storytelling to really pursue it, because we have a long way to go. To answer the broader question about clinicians and researchers, which I can't fully respond to because I've really never been down that career path. But I would say really this idea of and I love this topic that, quote unquote, save the world, but you actually could be doing harm in some ways by threatening the dignity of the people that you're working with. And so how I personally dealt with that is I've said to many people that this isn't just a professional kind of criteria. This is a philosophical and a personal criteria that you have to challenge your privilege. You have to understand your power in this world, not just in the global health world, but as whether it's American, whether it's male, whether it's whatever level of privilege you have, and fully come to terms with it and understand its impact on your work.
And also just to be able to be outside of your comfort zones. I'm definitely not somebody who lives in a bubble. Like, I don't go work at the UN and then spend all my time with people at the UN. We even spend time with people who make money like those at the UN. I'm in the streets in Brooklyn. I'm in refugee camps. I'm with young people. And I'm with high-level people at the UN. So I think being comfortable in different environments is key, but the only way to be comfortable in different environments is if you make yourself uncomfortable in places that you're not accustomed to. So I encourage young people to always, go out in your local community, go hang out with people you wouldn't normally hang out with, go spend a day in a nursing home, go, play basketball with people who live in poor areas or whatever it is. But I do think that, again, that good intentions aren't enough. And I think we as a global health community will do a lot better. And we've also been criticized a lot, just, in terms of this sort of savior complex, if we learn to truly be partners and not sort of aid people. So I do think about this on all day, but I guess that's sort of a summary of how I feel about this. But it's a very important topic and one that I think we need to really explore further and further and keep exploring.
Thank you, Lisa. We are now going to shift gears just a bit. Marie, the next question is for you. We are all teachers and learners, and mentors are invaluable. How have your mentors affected your work, and what do you think are the most important qualities to look for in a mentor?
Thank you so much for this question. This is where I'm spending a lot of my time these days on mentorship programs and in the literature and in practice. So I really appreciate this. And I'll put a plug in for an entire webinar on effective mentorship because I think there's an audience for it and there's certainly a need. In particular because we know from the literature and from anecdotal accounts that, strong mentorship at least, is linked to enhanced mentee productivity, self-efficacy, so your ability to believe that you can indeed succeed, career satisfaction, success of researchers in academia, benefits for underrepresented minorities, especially in terms of exposure and retention. So there are all of these fantastic benefits that come from really effective mentorship and some pretty horrendous outcomes that can come from poor mentorship. So thinking about how to look for good mentors is really vital to, I think, the success of people's careers. I know that I am eternally grateful for mentors who saw promise in me and helped me to cultivate that. So I think that one of the things that I often recommend students or peers to look for is for mentors who can help them define their career goals, that have the experience for helping mentees realize those career goals and really developing the ability and opportunity to progress towards those goals. So one of the things that I think has been really interesting in my ventures into mentoring, we have a current grant in Zambia where we've co-developed with the University of Zambia a really fantastic faculty mentorship program that's now really being woven into the institutional fabric of that place. And I think what I've learned from that is that there really are two functions that mentors serve. And thinking about identifying individual mentors or diverse mentors or teams of mentors that can fulfill those functions can help maximize those opportunities. And one of those functions is psychosocial. So thinking about people who can provide personal support, be a role model, provide counseling, acceptance, but also those who provide a more instrumental or career development function. So being a good coach, introducing mentees to networks, increasing visibility, sponsorship, kind of protecting people from
adversity, but also helping to propel them into conversations and groups where they wouldn't have been otherwise. So I think, imagining a diverse array of people that can really provide unique and overlapping support would be my recommendation. And I wish that I had been given that advice early on in my career. I think I ended up looking for people who provided primarily psychosocial support, which was great, but it was only until later in my career that I realized I needed to have people who looked different than I did, who had different kinds of approaches and interests to really broaden the access to opportunities that I wouldn't have had alone.
Thank you, Marie.
So this is Michael. I wanted to add something to the great stuff that Marie said. Is that okay?
Yes, please.
Great. So I say it's yes and. So I completely agree with everything that Marie had mentioned. And it felt like she was channeling my heart because I feel that same way. The only thing that I would add to it is that I've also found that mentoring, mentors, mentees, a two-way street. It's mutually beneficial. And so as I have served as a mentor, I have been mentored by my mentee and vice versa. And so I think that's a really great lesson learned also, is that it is a two-way street. And at the end of the day, both parties are bringing something to the relationship. And so it's not as static as some might believe. And a lot of times it's much more of a dynamic type of relationship where there is ebb and flow based on life experiences. Thank you.
Thank you, Michael.
I would totally agree, Michael. I think that's such a great addition. And it's something when you think about being simultaneously a mentor and a mentee, there's a mutual benefit that continues to accrue. So definitely.
Thank you. We have time for one last question. And Rebecca, I will direct it to you. This is a very practical question, I think. Rebecca, how do you recommend that someone who is looking to pivot from a different career into global health communicate that their skills are transferable to global health?
Yeah, this is a very interesting question to the sustainability and environment expert on our phone call today, right? Because I am working in a different sector, but I do see quite a lot of that kind of pivoting. And I think it can be very powerful, and I think it's partly powerful because of the irreducibility of a given sector's skills. And when you bring yourself to a new field, you do have a different toolkit, and that can be a wonderful thing. So one point I would make is that you would do one does well to look a little bit and do informational interviews and talk with people in the target field you're seeking to pivot towards, and begin to think about what are the gaps or weaknesses in that field that you might be able to help address and fill based on where you're coming from. There's no shame in that. The other thing I would say is that, and our phone call space is really filled with some pretty fundamental points or principles about global health engagement that have to do with confronting asymmetry in social relationships and intercultural competencies and respect and humility, and particular kinds of storytelling that buck dominant narratives of humanitarianism and interventionism, and dynamic capacities that one might have developed in another sector to manage diversity and internal capacity to tell stories and make either media or data management or, in fact, educational and mentorship programs more dynamic and accountable, mutually beneficial. One could from in a pivot moment. And all those things are things that I'm sort of drawing from our conversation today, but also from my work with in public health as well as in sustainability and environment, for example, or law, or social work, or, I work across a lot of professional school landscapes, in particular with the curricular innovation work I'm doing. For you to think about what you've done, where you are, and back to that, the core principles, skills, and competencies you've acquired to be taken elsewhere, or could be even new to the field you're entering in some way that you're going to be unique for and stand out for in a job search, for example, or a fellowship application program. Don't hide when you have to pivot or want to pivot or seek to integrate fields in your work in the ways many of us are advocating. You do need mentors who've been able to understand your through lines, your through stories. So maintaining relationships in the ways that, for example, Jennifer Staple and I have done over decades now is an important skill in itself. And this community that we're all part of, talking here today, even though we're all exhausted and, half of us are doing 5 other things because we have to while we're on this call, it's a really beautiful resource to have people that you're in dialogue with as you develop. And it's beautiful, too, if you are a mentor to someone, to figure out what is the thing that really inspires them, that makes them different from everyone else, and be able to articulate that. At a pivot point, it's important as well to be able to access the why I got into this in the first place and why I'm shifting gears now. What is the thing in my life and in the world that I'm addressing and that I'm bringing my energies to that motivates me and helps me navigate? And your advisees and your mentors will be really crucial to helping you articulate those things. And that kind of is the segue from the last question to this one. And a prop for this community, which is full of those kinds of relationships. I want to thank all of you.
Thank you, Rebecca. And thank you so much to all of our phenomenal panelists for sharing your insights and expertise today with our webinar audience. This concludes today's webinar.